Hi, this is James, and I want to ask you, did you know that half of the people with hepatitis B don't even know they have it? And in medicine, I didn't know doesn't stop transmission. It just means you might unknowingly pass it on to someone innocent like a newborn, a sexual partner, or heaven forbid, a healthcare worker or a medical student in a needle stick accident. So, understanding hepatitis B serology is absolutely essential, not just for your exams, but for real life clinical practice. In this lecture, I'm going to walk you through the hepatitis B serology panel and all those lovely acronyms that look like someone sneezed on the lab form. Whether you are prepping for finals, ward rounds, or this is your first patient with abnormal liver function test, this is the stuff you need to know. Subscribe and let's get started. I know, right? Hepatitis B virus structure looks amazing, like it was assembled by some alien engineers. Anyway, to really have a good discussion on hepatitis B serology, we definitely need to understand the structure of this virus. So, HBV is a DNA virus which has a partially double stranded DNA genome. It carries its own DNA polymerase right there, which has a reverse transcriptase activity, and that is how it replicates inside host cells. So, the DNA genome itself plus the nucleocapsid, it is all wrapped up in an outer lipid envelope. You see that ring of spikes, right? Which covers the DNA genome as well as the nucleocapsid. Embedded in that envelope are the famous hepatitis B surface antigens. So they come in various forms. We have the M, that is medium, large, and small. What matters is that they are all referred to as hepatitis B surface antigens. So this is the key word to remember on serology: hepatitis B surface antigens. Okay, this is the important thing I want you to remember. Now, also inside that envelope is the nucleocapsid, which contains two important antigens that I want you to remember. That is the core antigen right there. You can see that. Okay, and another antigen known as HBeAg. Now, HBeAg is secreted protein that correlates with viral replication and infectivity. That means if a patient has this, that means they are very contagious. Okay, we'll talk about that very soon. So, the hepatitis B surface antigens, HBsAg, and hepatitis B E antigen, these antigens circulate in the blood, and it means that we can actually test them or we can find them in the blood. A key point to note is that, in contrast, this antigen does not circulate in the peripheral blood, and so you cannot detect them in the blood. However, you can find them expressed on infected liver cells. All right, so we're going to try to simplify the key markers. We're going to start with the hepatitis B surface antigen. So this is the way I want you to think about it. When you see this, think like this. Do you currently have the hepatitis B infection? Currently. Okay, that's the question you ask yourself. And if this is positive, then it means you currently are infected. But the thing is that we cannot tell if it is acute or chronic. That means this antigen will not help us to differentiate between chronic and acute infection. Okay, if this surface antigen sticks around more than 6 months, it is a chronic hepatitis B. It is actually also the same antigen used in making the hepatitis B vaccine. Hence, it can be temporarily positive within 30 days after vaccination. So don't panic and diagnose yourself too soon. Now, this is the tip. Think of the surface antigen as the virus waving a flag saying, I am here. Okay, the next is going to be total anti-HBc. So when I say total anti-HBc, that is antibodies against core proteins. So here I will talk about IgM and IgG, and the two put together is the total anti-HBc. Okay, the question here is, have you ever been infected with hepatitis B infection? Okay, if the answer is positive to the total anti-HBc, this implies past or current infection. But I need you to take a look at IgM. Okay, IgM, when I say IgM, I mean IgM anti-HBc. Okay, which is actually the first to appear in acute infection. In acute infection, IgM will be positive. It may also be the only detectable marker when the surface antigen that we just talked about drops off temporarily in early infection, aka the window period. Okay, so it is, however, not present in vaccinated individuals because the vaccine doesn't include the core antigen. The vaccine is made from the surface antigen. Now we're going to talk about the surface antigen antibodies right here. Okay, and when we say this, the question you ask yourself is, are you immune to hepatitis B infection? Are you immune? If that is positive, then it generally means that you have recovered from an infection or you have had a successful vaccination. Normally, this is found after clearance of the surface antigens. Okay, and it shows up when the fight is won. Okay, the next one we're going to talk about is the HBe antigens. And this tells us how infectious is the person. If this is positive, then it means there is a high viral replication, that is a high infectivity, the person is contagious, and this is often seen in acute or active chronic infections. So think of it as the virus bragging and saying that not only am I here, but I'm also multiplying like crazy. So after exposure, the body is just starting to recognize the hepatitis B virus. So it is the surface antigens that appear first. You can see that depicted in red, and they are actually the first antigen markers to become detectable. They appear somewhere on week 4, and it might peak somewhere on week 12. But however, it may differ from person to person because the immune response won't be the same. Okay, again, it is worth noting that if the surface antigens are persistent beyond 6 months, that is going to be termed a chronic hepatitis infection. If it is less than 6 months, then we would say that it is an acute infection. Okay, so soon after the formation of the surface antigen, we also see the formation of hepatitis B E antigens. As you can see, it starts forming somewhere right after the formation of the surface antigens. Okay, they indicate viral replication and high infectivity, meaning that the patient at this point is very infectious or very contagious when these antigens are positive. Okay, obviously, the immune system now wants to fight back. So there is going to be the development of antibodies. So we're going to talk about total anti-HBc, which is the total antibodies against the core proteins. You can see this representation right there. This is the total anti-HBc. And when I say total, it means immunoglobulin M plus immunoglobulin G. Okay. First, IgM rises and then it signals acute infection. Then later, IgG will take over and that will signal past infection. So when I talk about this IgM, I also want you to see this graph, this representation right there. This is IgM, which is a part of the total anti-HBc, but specifically this is IgM anti-HBc. Okay, this dashed graph here, that is this, the immunoglobulin M. Now, why is this important? Because there is a time that we call the window period, which is very important. It's a tricky diagnostic window, so you don't have to miss it. Okay, this is where the surface antigens cannot be seen anymore. That is, they disappear. So it's going to be hard for us to tell if there is an acute infection. At the same time, there is no generation of antibodies towards the surface antigens. They have not been formed yet. So it is going to be hard for us to detect acute hepatitis sometimes in this period, which we call the window period. And this is where you need immunoglobulin M anti-HBc to help you with that. So whenever in the exams you are asked in the window period which antibodies are the best, you're going to talk about immunoglobulin M anti-HBc, which is going to help you to detect the window period. Okay, then we're going to talk about the recovery phase where there's going to be the formation of antibodies against the surface antigens, in other words, anti-HBs. As you can see, this is where it starts. And somewhere as it starts, you can also see that there is also the production of anti-HBe. Okay, somewhere around the same time, which tells us that infectivity is decreasing. Okay. The CDC recommends screening all adults 18 years and over at least once in their lifetime using the triple panel test. So if you are watching and over 18 years, well, you know what to do. It also recommends to test all infants born to mothers with positive surface antigens. Okay, now this is true because these babies are high risk for perinatal transmission. They should receive the hepatitis B immunoglobulin within 12 hours after birth. And that should also be followed with the hepatitis B vaccine as well. Okay. It also recommends to screen all pregnant women for hepatitis B surface antigen right there during each pregnancy, regardless of vaccination status or history of testing. Again, think about high risk contingents like healthcare workers, dialysis patients, HIV patients. They may need screening and vaccination if they are not immune. Many adults recover fully and do not develop chronic infection. Majority of newborns and children infected with hepatitis B infection become chronic carriers, hence prevention is key. Chronic hepatitis B infections may be asymptomatic, last a lifetime, and may lead to complications such as cirrhosis or liver cancer.
Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.